Dr. Kanta Subbarao is the director of the WHO Collaborating Center for Reference and Research on Influenza and professor of the Department of Microbiology and Immunology at the University of Melbourne at the Peter Doherty Institute for Infection and Immunity. Kanta, it's such a pleasure to have you here and to see you again, though virtually.
Thank you very much. I really think back to when you visited us here in Melbourne.
It was a couple of years ago. Since leaving CMC, you've gone on to do pediatric infectious diseases, epidemiology, residency training, doctoral and postdoctoral training, mostly in the US, and ending with postdoc training in virology and vaccine development at the National Institute of Allergy and Infectious Diseases. You've been through the CDC, you've been at NIH for a while. You now lead a World Health Organization collaborating center for reference and research on influenza. Can you tell us a little about how you came to these truly extraordinary opportunities? And as a follow-up, could you tell us what role your CMC education played in the advancement of your professional life into these roles and your career choices?
Sure. So I think, to be honest, I think in big part, everything has followed from the fact that I got a spectacularly good education at CMC. I think I got the sort of initial education and values from CMC. A lot of how I've ended up in my career has been being at the right place at the right time, and a lot of luck, and having the sort of background and training to be able to take opportunities that came my way. So I certainly didn't think when I was finishing my MBBS at CMC that I would be doing what I do today. I left CMC really trying to decide between becoming an ophthalmologist and a pediatrician. And certainly, becoming a virologist wasn't really on the cards. But, I would say it's important to keep an open mind and see where life takes you. I think science has been fantastic. I love my job. I like my career. I wouldn't change very much about it.
Well, I think that's pretty incredible. And talking about being in the right place at the right time, all of your work on new viral diseases, especially of the respiratory tract, has turned out to be so relevant and important during the COVID-19 pandemic. Could you tell us a little more about the implications of the research that you have done in the past and how that has informed the work that you're doing on COVID-19 now?
Yeah, so I have worked on respiratory viruses for what seems like forever. So I got into it as a fellow when I was doing my infectious disease fellowship in the US. And I decided then to go into virology and was interested, as most pediatricians would be, I was very interested in respiratory syncytial virus. And I worked on that for a few years, even when I left my fellowship and started an independent job, an independent research career. But I realized pretty quickly that I needed more training. I needed to and this was the late 80s. I've been trained as a classical virologist, but I really didn't have any immunology training or molecular training. And so I felt that I should go get some more training. And I heard about the lab at the NIH, the Laboratory of Infectious Diseases, where many of these viruses were discovered by Bob Chanuk, including RSV, and some parainfluenza viruses, and mycoplasma, and so on. So I decided to see whether I could go there for training. And I was really, at the time that I interviewed, keen to work on RSV, but I was told that the RSV positions were committed. And Brian Murphy, who I then worked with, wanted me to work on influenza. And I sort of went there kicking and screaming a little bit, thinking, oh, I don't know. I don't know about influenza. It's just so complicated. Everything that you've thought of doing has been done. There's 50 years of literature, all the subtypes. But it was probably the best decision of my life because influenza is so incredible in what you can do with manipulating the genome and creating new viruses and studying them. So that's how I got into influenza. When I was at the CDC, 3 months after I arrived, the first human case of H5N1 infection occurred in a child in Hong Kong. And they went on a few months later to have an additional 18 cases. And my lab, I was by then the head of the molecular influenza lab. And my lab characterized that first H5 virus from Hong Kong. And that, I think, is another place where my career completely shifted. Where I went from working on seasonal influenza viruses that affect humans to these potential pandemic strains. Now, of course, H5 never did turn into a pandemic, but we remain very concerned about the risks of those viruses. And so that's where I learned how to work in a level 3 containment lab with a respirator on and working with these viruses that are at the animal-human interface. And then after I left the CDC, I brought together the first part of my training, which is in vaccine development, with these potential pandemic strains. And then for the next, I would say, 14 years, worked on trying to develop vaccines against potential pandemic strains of flu. And then 3 months after I moved to the NIH to set this program up, SARS emerged. And so again, because of my prior training and contacts, and the fact that I was comfortable in a level 3 containment lab, I worked on SARS for about 5 years. So here we are in 2020 when SARS coronavirus 2 emerged. I sort of knew what I could do and have been working on the immune response, working on some antiviral work, and looking at human stem cell derived organoids.
You've done clinical training, advanced clinical training, and then you've done very, very high level research. And you've lived and worked on multiple continents. I can't imagine that any of this was easy for you. So how do you make your choices?
So some of this happens, the circumstances evolve in a way or opportunities emerge. So when I left India, I really thought I would go back. I really intended to go back. And in some ways, what I chose to work on was designed so that I could go back to India. But it was very hard in the 80s to return to India, 80s and early 90s. It was really hard. I think people are returning more now than they did back in that particular era. So after a while, I just figured that I would instead work on as much as I could collaboratively, or work on things that would be important to the developing world, even if I didn't actually live in India. The move to Australia was serendipitous. There are 5 WHO collaborating centers around the world. One of them is in Melbourne. It's been around for about 28 years or so now. And the directorship of that opened up, and I was contacted to see if I would be interested in applying. And my husband actually his family had moved to Australia in the 70s. And so we had a bit of a family connection here. And so, essentially it was, are we ready for a change? Should we go take a look at it? Would it be nice to do, as one, part of your life? And what it did for me is it allowed me to move from a very focused research lab environment to an interaction with the WHO and moving sort of onto a global scale.
I think that's absolutely incredible. But bringing you back finally to where you started from, what would you say, which parts of the CMC experience do you think influenced you most personally and professionally?
So what I did get from CMC are a couple of things. So obviously, it's the academic excellence, the great training, and what I have done in my life in terms of as a researcher is all very applied research. So I think that is something that I took away from CMC, the fact that you could build and sort of influence public health. So still serving the public in some fashion, even though I'm not taking care of patients on a regular basis, I'm not providing primary care. But I think that sort of comes from the CMC experience. And then the third thing I would say is networking. I think CMC has an incredible network. We are all very close with our classmates and people a few years ahead and behind. And then yet, you know, you can move overseas and there's another network of people that you may have never met during your college years, but they immediately, you know, will sort of recognize and accept you as having had this shared background.
Thanks so much for joining us, Kanta. It's been such a pleasure talking to you.
Thank you so much, Cherry.